Okay, so today I'm going to be going and doing a baseline assessment on our patient here, and we're also ordered to do vital signs, and we're going to be inserting the Foley catheter and also giving her an injection of pain medication. So we're first going to start off with her baseline assessment. So I'm just going to walk in the room. Hello, my name is Casey, and I'm your student nurse today. Could you tell me your name and birth date? Esther Bailey. Okay, awesome. Her name and birthday and number on her band match my records. So thank you so much for that. So today we are going to be doing a baseline assessment on you, and that is where we're just going to be assessing you from your head to your toe. We're just going to be like checking your heart, just seeing how well everything is functioning and seeing if there's anything that needs to be brought to our attention. So just to start off first, I'm going to give us privacy. All right, and I'm also going to assess the room, do a safety inspection. So I'm just looking around. We don't have anything that I see is not safe. Our wheels are locked. I will put her bed down into the lowest position. It was about there. I'm gonna just make sure she is comfortable. She's asked if we could put her head up a little bit, so I'm gonna put her head up a little bit. Okay, so now we're just gonna get started. So I did the safety inspection. We have privacy. I have explained to her about what we're gonna be doing today. Do you have any questions for me? No? Okay, so we don't have any questions. So I think that we can get started. I'm also right now, I'm gonna just kind of inspect her mood, her affect, just how she's reacting with me, and just how her mood is in general, which I feel that she's doing well right now. So we're going to get started. So first off, I'm gonna ask her her name. So can you tell me your name? Esther Bailey. Okay, awesome. Do you know around what time it is? It's around 3 o'clock? Yeah, that's about right. Do you know where you're at? You're at the hospital? Yep. All right. Do you know who the President of the United States is? Joe Biden. Okay, good. Glad you know that. All right. And now what we're going to do is I'm just going to shine this light in your eye. And if you could just look straight ahead, I'll just shine it in your eye. So I'm going to watch for the pupils on both sides. Great. Now I'll just have her follow this without moving her head. All right, awesome. And so I just did Perla. Her pupils are equal, round, reactive to light and accommodation. So that's great. So now I'm going to move down to the ear, nose, and throat. So first I'm just going to inspect her head and facial structures, see if there's anything I feel tender, anything out of the ordinary, which I am not feeling anything. And I am going to look up her nasal cavity. I'm going to ask her to stick out her tongue. I'll look back in her throat. I'm going to look in her ears. And I'm going to ask her about her hearing. Esther, do you have any problems with hearing? Do you wear hearing aids? Are you able to hear me well right now? You don't have any problems with hearing. You can understand me? Okay, great. All right, so we are done with the ear, nose, and throat section. So now I'm going to move down to the cardiovascular. So first I am just going to watch her chest, see if I can tell if she has any distress. I'm going to watch for rate and rhythm. So I just watched that. It seems like it is good. I'm going to inspect her chest, see if there is anything that looks out of the ordinary, which it looks normal. So I'm going to now ask her also if she has any chest pain or discomfort, which she says she does not. So I am now going to listen in the PMI. I'm going to assess the rate and rhythm for a full minute if this was a real patient. Okay, and now I'm just going to listen to her heart. So I'm going to listen to the aortic point, the pulmonic point, the Erb's point, the tricuspid point, and the the mitral point. Okay, everything sounds really great. Her rate and rhythm sound good. I can hear it really well. I'm just gonna put this down so I can get closer to the bed. And now I am going to just feel her extremities for any tenderness. And also I'll be checking to see if there's like any hot spots for the temperature, if there's anywhere that's hot or cold that's out of the ordinary. And I will now check for any edema, which while I was feeling around, I do not see any edema, so that's great. I'm gonna check distal pulses. That's 2+ bilaterally. And that's also 2+ bilaterally. That's really good. I'm gonna check for her capillary refill. That's less than 1 second. That is really great, Esther. All right, I'm gonna put this back up. And also I'll ask her why I was feeling your extremities. Did you feel any tenderness? No? Okay, awesome. Okay, now that we are done with cardiovascular, I'm gonna move on to the pulmonary. So I'm just also going to just kind of watch her breathe. I'm going to look at her chest. I'm gonna ask her if she has any respiratory discomfort or any cough. She says she does not have any. She's able to breathe, she has no cough. That's really great. So I'm going to listen to her lungs now, and I'll start on the front. And I'll just ask her to take deep breaths while I do this through her mouth. All right, her breath sounds, they are clear. They sound really great. And now, if this was a real person, I would ask them to sit up to the side of the bed so that I could listen to their back. And with our patient here that is not able to help out a lot and we don't have extra help, and also she has surgery on her stomach right now, which is very sore, so we're just gonna do the best that we can. So I'm just gonna ask her to, if she can help me just roll over that way so I'm able to see her back, and I'm just gonna listen the best that we can do today. So I'm just gonna ask her to hold the side of the bed here. And also while we're back here, I'm just gonna also be looking at her skin integrity on the back of her self, which looks really well. And the patient is tolerating this well, so I'm just gonna listen. Okay, so those sounded really well. Patient tolerated being able to be on her side for a few moments well. I'm just gonna help her get back comfortable. So that sounded good. So now I'm going to move on to her abdominal section. First, I'm just going to inspect it, which she does. She had surgery, so we know that. And the doctor just recently looked at her bandage. Give her a little privacy here. Looked at her bandage, it was clean. He did not see any reason for us to change the dressing, so we're just going to leave that alone. So first, I am just looking at it besides the bandage. It looks great. I'm going to first listen to bowel sounds. And since she just had surgery, that's important since she is taking pain medication that might cause constipation. Just gonna listen in each 4 quadrants. Okay, and I hear slight bowel sounds, not super regular, but they are faint, but they're there. And so now that this is here, we normally will palpate around the stomach, but I am not going to touch where the bandage is, so I'm just going to feel around it. So I'll do that now. I'll let her know to tell me to stop if it hurts too much. I'll just ask her to let me know if there's any tenderness out here, and I'll just feel for anything that might be out of the ordinary. If I feel any bulges, just anything that is not normal. So that is, I don't feel anything, and she says that it did not hurt touching around it. So, and now I'll ask about her diet. I'll ask her what her meals are like, how much she eats, if she has any nausea or vomiting, which she does say that she's having. She's having some nausea since she just had that surgery. Things just aren't sitting super well. So she is having nausea. She says that besides this, she normally eats all of her meals. But right now she is on a clear liquid diet. She says her bowel movements are typically normal. Right now she has not had one after surgery. And so yeah, her diet is clear liquid. Her bowel movements are not quite normal because of this surgery, but besides that, they have been normal. And I will ask her now about her urinating, which she let me know that she is not able to urinate right now, which in the orders we did see that, and we're going to address that and be putting in a Foley catheter in a few moments. So we'll do that soon. She says though that she normally does not have any burning or discomfort when urinating. It's just this, right now she's unable to urinate. So that's done for there. Now we'll go to musculoskeletal. I'm gonna ask her to just, she could squeeze my hands, push them up, down. Though she has strong grip, I'm gonna ask her to push on my hands, back and forth. Right, that's great. And I would assess her gait, which I saw her get up for a moment. When I first walked in, I was able to see that her gait is good right now. So that's good. And also, while I've been doing this whole thing, I would also look for any, for safety reasons, just for me to know, any lines, devices, tubes, catheter tubing, oxygen tubing, anything like that, which at this point we do not have. So, yeah. We assessed for musculoskeletal, and now I am going to, I'm going to check her skin. And also at the musculoskeletal, we would also check to see if anywhere is tender, which a few moments ago we asked her that when we were filling her extremities. So she does not have any pain or tenderness in her extremities. So now I'm going to just look at her skin, her color, the integrity, which everywhere looks great. Her tuber looks good. The integrity looks good. She does have her wound here that, since she does have the wound, we would then assess for the type of wound, any drainage, any smell, the type of drainage, the type of wound, measure the wound if necessary, and things such as that. But other than that, her color is good, her integrity is good, her tuber is good, so that is all great. And then now I will ask her pain scale, which she told us was a 7 out of 10 on a scale from 0 to 10, 10 being the worst. So then we would then ask her Caldera questions, which I'd ask her the characteristics of her pain, the onset, when did it start, we're going to come back to the L. The duration of her pain, so how often it comes on, the exacerbation. Is there anything that makes the pain worse or better or anything like that? Does it radiate anywhere? And then also if there's any accommodating or any symptoms that come with it, associated symptoms. And she says that there is just the nausea that comes with this pain. And so that is that. And and also we missed the duration of the pain, so how long does it last when it typically comes on. So we'll move on now. So the last thing I would do is I would assess her IV. So I'd look to see if she has an IV, which we have no IVs right now, but if she did have an IV, I would assess the location of it, the gauge, the type, if there's anything running through it, and then I would also look for phlebitis. And that is where the IV, or where the vein gets kind of inflamed and infected and is super painful. And also if it was infiltrated, which is when the whatever is going into the IV, it is starts to go around it, and that means it's infiltrated. So she does not have an IV though, so that is great. And now we are going to make sure she is just comfortable. Comfortable, that the bed is down in the lowest position, which it is. She is safe. We're going to be right back because we are going to give her some pain medication that she is asking for. So we're going to go draw that up to make sure she doesn't need anything. She's got her call light. So we'll now go over here and we're going to do this medication. Okay. Okay, so first we are going to look the medication we're giving, which we are going to be giving this ketorolac tromethamine. So there's that, and I am just going to check the order to ensure that it is the same. All right, it's right there. So that's what we're going to be giving. Okay. So now I am just going to draw it up. And so I will get all this. I'm gonna get all our stuff and then we can go into the patient's room. I believe that is all. We are going to draw it up. So it says that we are going to be drawing up 30 milligrams. I'm going to put gloves on. Okay, so I did the math before we started this, before we came over here, and it will it wants us to draw up 30 milligrams. Our medication is 60 milligrams per 2 milliliters. And the math is that we're going to draw up a 1 milliliter. So that's what we're going to do today. And I am going to do my first check right now since I'm just getting it out and such. So I'm going to check that it is ketorolac terimethine, that it matches right here. We have the right patient. We have the right drug, our ketorolac terimethine. The dose, we're going to be drawing up 1 milliliter. Our route is we're doing it intramuscular, and the time, it says stat, so we're doing it right now. So we've done our first check. Everything looks great. We have our right patient, our right medication. We're safe. Okay. First, I'm going to. Okay, so I'm going to draw up 1 milliliter of air. Now, I need to clean the top of that, so I am just going to do the one-handed scooping method. Put that back. So that is on there. We're keeping it sanitary. And I am going to wash the top of that off. We'll do this for 30 seconds. Okay. And I am going to need another one of these to do the patient's arm, so I'm just going to go grab another one. Okay, so I'm going to drop the medication now. We'll just drop that off. We've got 1 milliliter of air. I'm going to push that in. All right, now we're going to draw up our medication. Okay, so 1 milliliter of air. I'm just gonna get all the bubbles out. All right, it looks good. And if I had another nurse here, I would have her double check it with me. So I'm gonna do the one-handed scooping method. All right, there. Okay, so now we are all ready to go to the patient. And I'm going to do my second check right now before I go give it. And so we have our right patient here. We have Esther here. So we have the right patient. We have the right drug. We have drawn up ketorolac terimethine. And that's what we have on the chart. We have the right dose. We've done the math. It is 1 milliliter that we are giving. The route is intramuscular, which we have drawn up. We're going to go do. And the time is right now. So I'm going to go over into by the patient's bedside. I'm just gonna set them up to a comfortable height for both of us. And this is where I do my third check. I just make sure that we have the right patient still, which we do. The right time, the right drug. We've got the right drug. We have the right dose, and we're giving it the right route. So I've done my 3 checks, done all my checks, and we are now going to give the medication. And I would just talk the patient through this, and also I would go through the action of this drug with the patient, the special nursing considerations, the reason that we're giving this medication, the safe dose ranges, and any side effects that the patient might exhibit. So I just ask any questions about that, or they can ask me any questions about any of those things. I just explain it really thoroughly to them, make sure they are informed. And I would ask them which arm they would prefer it in, which Esther here would like it in her left arm. So we're going to do it here, right here in the deltoid. So I'm just going to try to move the patient's arm in a way that All right, right there. All right, so I'm just gonna wipe her arm off super well. Okay, and now we're gonna do the Z-track method. I'm just gonna take the top off. We're gonna do it in a dart-like fashion. So I am just gonna pull the skin over like a Z-step or a Z-track and just do a dart. Now that we're in, I'm just gonna insert it slowly. Take it out. I would put a Band-Aid on it. If needed, I'm gonna put this right into the sharps container. All right. And then I would just come back and I would let her know that I'm gonna come back and see how this medication is working for her, how she's doing, if any side effects are happening, and just let her know that I am gonna come back in about 30 minutes. And then I would just go document it, which I am going to document it right now. So I'm gonna put that we have our right. Let's see. We're gonna scan. Which before I did this, I would scan her armband. So we have scanned her armband. As confirmed, we have the right patient. Oh, we need to push. Okay. So we would do this before we administered. We would scan the barcode. It's not match. This barcode is not working, so I'm going to go get the one on her wrist. Okay, right here, Esther Bailey. Okay, so it says that matched, and like I said again, we would scan that before we gave the medication. So we did that. We gave the right drug. We checked that many times. Scan the medication. Okay, so we scanned the medication. We gave the right dose, the right route, and the right time. And as we did the 3 checks, we went through all those, so we made sure that those are correct. And I'm gonna put that we checked her birth date because when we first originally came in here, we asked all those questions. Date, right time. Oh, this is what we're missing. I have completed my 3 checks, which we did. Okay, so we now put that we administered that. So we are all finished with that. We have documented it. We have given it. So now I'm just going to take all my stuff out. Just make sure the patient is comfortable, has all their stuff, and let them know I'm going to just grab my Foley catheter kit, and we will be right back in. Leave our computer out here. Okay, now I'm just gonna grab our Foley catheter kit. Okay. Now I'm just going to set up over here so I'm able to be close to the patient with all of my things I need. Okay. Just gonna move our things so that we have space. Okay, so first off, I'm gonna take off anything that could possibly, I'm just gonna put it over here on my other desk, that could get in the way. Actually, I'm gonna tuck my shirt in a little bit because I feel like that could touch the patient and make it non-sterile. So we are ready. So first what I'm going to do, I'm going to raise the patient up to a working height for me. Oh, garbage can's going to fall. All right, so I'm just going to move the patient to a working height. Okay, so we're going to do right here, I'm going to put the patient's head down. Just make sure that they're comfortable. And as I'm in here, I would of course I would introduce myself if needed to be, but since I have been in here for the last 20 minutes, the patient still recognizes me, and so, but I would, if I needed to, reintroduce myself. And we've already done all the beginning steps, but when I was out there, I just would check my order and ensure that we needed a Foley catheter, which it does. It says stat, so we need to put a Foley catheter in right now. And yeah, so I would just go through with the patient, let them know why we are doing this catheter, what this catheter is. That might be a little bit uncomfortable, but we're gonna help them get through it. We'll breathe together and just answer any questions they have. Just make sure they're very informed. So now that the patient is down, they said they're comfortable how they're laying. I'm just gonna put gloves on, and we're just gonna start and clean the patient. Our leg bed doesn't look super even, so I'm gonna put the legs down. Okay, so first I'm going to put this down. We still have our privacy. I'm the only one right here, so move that. So I am going to put the patient's legs like so. So you just put their legs together, let the knees kind of drape out naturally to give us the best working space that we can have. Okay, so Esther says that she's comfortable. So we are just going to first wipe her off with this. And I would, of course, do hand hygiene. That's why I will start by putting Germ-X on. So we do hand hygiene. We're gonna pull the gloves out. Okay, so did hand hygiene. Put my gloves on. Okay, so now we've got our garbage can close by. It fell over. I am going to take my gloves off and I am going to grab it, put it right here. Okay, now I'm gonna do hand hygiene again. You'd always do hand hygiene before everything that you do. Okay, we're ready to begin now. Okay, so first I'm gonna get these wet wipes. I'm just gonna clean off the patient's peri area. So I'm gonna just fold it up, and this first corner, I'm just gonna wipe down this side. I'm gonna do this corner. I'm gonna do this side, and then I'm gonna get one more. We're gonna go right down the middle. I'm gonna do one other one, and I'm just gonna wipe off just kind of everywhere that we are going to be working with. Okay, so now I'm going to do hand hygiene again. Okay. Now I'm just gonna put that over there. I'm going to wipe down our counter. Make sure it's really clean. Okay. And now I'm just going to no, we'll take. Okay, I'm gonna take those off, do hand hygiene, and now we are going to open up the container. Now that we're beginning this sterile procedure, I'll just make sure my hands stay up here at working height. Okay. All right, and we're gonna begin. I'm just gonna open this up. Just observing that 1-inch line, making sure we're not contaminating anything. Okay, so I'm just gonna turn it so that I am not going to touch it. Okay, so I have not touched the inside. Everything is sterile still. I'm going to get this out. Put my gloves on. I'm just gonna Alright, so I'm just gonna grab this glove here, just on the cuff of it, with this hand. I'm gonna put it on. Okay, and that is on. Up. I'm going to grab the sterile part of the glove with my sterile glove. I'm going to put my fingers under the cuff. Okay, so now I'm gonna get the drapes. And I am going to put it under the patient. Ensuring I don't touch the patient. Put this on. Okay, great. Now we're gonna open up all our supplies. Put that. So I'm just gonna leave it in the package and we're just gonna keep it right here. dump my lube out. Figure out how to put this here. Okay, now I'm going to lubricate 2 to 4 inches of the end of my catheter. Just take that back in here. I'm gonna get my saline. I'm gonna hook it on. Alright, at this time I'm just going to take this off so I can see what I'm working with, and we're just going to be done with that. That went in the garbage. Okay, we're going to hook it on here. Sure that it stays in here. Okay, so now I'm going to transport this over to the patient between the legs. Okay, so now I am going to put my hand right here, and this hand is now contaminated. Let's get my swabs out. Okay, I'm gonna do one swab down this side. That side. Do in the middle. And then we'll call that good. Gonna get rid of that. Okay, so now I'm just gonna explain to the patient, just to void down, take deep breaths, and I'm going to now insert the catheter. And I'm not going to force anything. Just gonna gently put it in. I'm not feeling anything that's blocking. We're gonna put it in until we see flashback, which I see flashback, so I'm going to put about 5 mLs in. So to there. Now I'm going to take that off. I'm going to slightly pull. Oh, it's right there. So it is in correctly and good. So now the sterile procedure is finished. So I'm going to take this off. And also before this, I would ask the patient if they had any allergies to latex or to iodine, which they did not. They let us know that they were just allergic to Percocet, so we know of that allergy. And I would then also get a wipe, clean up the patient of any iodine, since that can be irritating. So I could just get a wipe, clean up anywhere that has iodine on it. All right, and now I am going to attach this to the patient. It's going to go right here. And we just want to make sure we give them enough room to move so it never tugs. I could help them back to a comfortable position with their legs. I'm gonna hang this. I do not want to hang it on the bed rail, so I'll put it on the frame of the bed below the thigh. So I see what's down there now. Take that off. Do hand hygiene. I'm now going to, we can cover the patient back up. I will cover back up. I'm going to put them back into the lowest position possible so that they are safe. Okay, and I would just make sure that the patient is comfortable, that they don't have any questions. I make sure they have their water, their phone, their call light. Let them know. I'll come back and check and see how their catheter bag is feeling, how they're feeling about it, if they have any pain, and so on, and answer any questions. And now I'll just document immediately after that. We're good.